Abnormal weight gain. Some people will come in and say, I've never been this way before, stating that they've never been heavy, they haven't been fatigued, they haven't had dry hair in the past, and it's only recently that things have changed. Well, it's multifactorial, as I'll tell everybody. The reasons for gaining weight in an abnormal speed are so many. There's so many reasons, but you still have to look at the most life-threatening: cancer, thyroid disease, problems with heart disease. All of these can cause abnormal weight gain quickly. So those are things that can be worked up with your doctor. We can certainly do the workup in the immediate care center, but we're limited as far as what we can get. If we get an x-ray and an EKG and everything looks cool, and maybe a blood sugar and everything looks good, don't just stop there. You really need a doctor that would listen to you and kind of be a detective to figure out why the change has occurred. Again, it's multifactorial, so if you look into my anti-inflammatory lifestyle, I like to consider reasons for mental stability as being a cause for weight gain, reasons for physical inactivity as being a cause for weight gain, reasons for nutritional deficiencies as being a cause for weight gain. I think those three are the easiest to touch on. There's certainly a whole bunch of other things you have to look into. Again, if the doc can look into life-threatening disease and rule that out, then cool, but you really have to continue diving into what caused this and get you to reverse all the problems. And the likelihood is, if you're 40 to 50 years of age and you come in with a abnormal weight gain suddenly, you got 30 years to 40 years that you have to reverse. So doing it on your own is really challenging. Getting some help would be the best thing. Insurance doesn't always cover healthy things, wellness. It covers Band-Aid therapy, it covers looking for big disease, but you kind of have to invest in making a lifestyle change that will be sustainable, as I'll talk about in the anti-inflammatory lifestyle. But again, to give guidance for those of you who don't have docs, it's important to get into a primary care doctor. That's OB, family practice, internal medicine, or pediatrics. Get into a primary care doctor to establish your level of health, make sure there's nothing dangerous, and then try to translate into what's feasible for you as a patient, the initiation of a change. And that could be first starting with stress relief in the behavioral field, first starting with nutrition, or first starting with activity. So please, bottom line is to get cleared first and then get the help you need. You might have to go outside of regular medicine, Western medicine, and that's the price you pay. Is if you want to invest in change, you'll have to invest with time, invest with money, invest with learning new nutrition. Michael Pollan's book, Cooked, is excellent. I'm not sure people really take the time to read books anymore, but I think if you just listen to some of these great minds, Andy Weil, Deepak Chopra, Richie Davidson, if you just take the time to learn what these great minds of today are giving us out there for information to help with change, or at least to help empower us to change, you'll be surprised. Study out of California on people trying to lose weight showed that people that bought the book to help make a change in life, the Zone, the Atkins, the Pritikin, the Ornish, usually didn't read the whole thing. They started, they initiated half-assed, and then they usually gave up before the 12-month mark. So get some help. Don't do it alone. Most of all, use what's in your power to make sure things are investigated so bad disease is ruled out. But again, don't stop. Keep on going and investigating and finding your way to make the change. By the way, I thought it was fitting to do a talk on abnormal weight gain in front of a fridge, because that's probably the number one reason for weight gain. However, I'm putting this addendum together to give you some ideas. Every doctor is different as far as what how they like to work things up. If it were me, I would look for the worst things available, and that's usually with a chest X-ray, maybe an EKG to make sure the heart and the lungs are okay. If you're a smoker, that's very important as far as abnormal weight gain. I'd always look into thyroid disease, cholesterol problems, diabetes, And then just abnormal nutritional deficiencies. I think they were very important to look into for finding disease or finding a starting point to work at as far as reversing disease. Psychology care, psychology evaluation is important as part of the anti-inflammatory lifestyle change. Sometimes it's harder to get into behavioral health, and it's easy access to at least start with the medical problems. Physical activity, usually most people are lacking, so you have to invest in something that you like, something that's sustainable, something that's creative. So usually if you set the intention to make a change, something will come up and you'll see it in an advertisement or billboard passing by. But once the thyroid is ruled out, once we find that there's no anemia, once we find the liver and the kidneys are okay with blood testing, and the chest is fine and the heart's okay, sometimes rheumatology is important, joint disease, rheumatologists look for cardiovascular problems. It all depends on what the doctor finds as far as other associated diseases and or symptoms, your family history, and what your physical exam is. So again, empower yourself to ask, don't feel shy, ask your doctor, how can we change and what else can we look for?